week marks the start of flu season, and some doctors are predicting this year's flu will likely be much worse than last year. But why is that?
Well, there's one very good reason, but yes, a very good conversation to have about just how bad we think it's going to be. Fox 61's Julia LeBlanc spoke with an infectious disease specialist at Hartford Hospital who has that answer for us. She joins us live now from Hartford. Good morning, Julia.
Good morning to you. Yeah, flu season is coming as soon as Friday, and Dr. Wu with Hartford HealthCare says because we're not wearing masks as often as we were this time last year, they are expecting flu season to be a lot worse than it was last year during peak flu season. So when exactly is that? Well, in a normal flu season, we will start to see some sporadic cases in October, and then in November, they'll start to kick up a little bit, and especially in December. Now, typically, the peak of flu season comes in late January, early February. Now, to get ahead, Dr. Wu recommends everybody gets their flu shot toward the end of October. That's so immunity can last throughout the flu season, which runs until April. Now, once the flu becomes more prevalent in our community, Dr. Wu says it'll be difficult to tell the difference between the flu and COVID if you're sick, in part because vaccinated people are showing much more minor symptoms of COVID. So here's what Dr. Wu says to look out for.
There's really not anything major that's going to distinguish between the two. Both of them can produce very high fevers. Both of them can produce it can produce chills as well. Both of them can be associated with GI upset as well. But I think the things that would maybe make you lean towards COVID is shortness of breath and cough, though that certainly can happen in the later stages of influenza.
Now, since COVID is more prevalent in our community than the flu is right now, Dr. Wu says if you're sick right now, it's probably more likely COVID than the flu. But once flu season picks up, he says just to be safe, make sure you get tested for both viruses. Now, what about those who haven't gotten their COVID-19 vaccine or their booster shot yet, and they're still looking to get their flu shot again in late October? Dr. Wu says the timing between those two shots really doesn't matter. We are live in Hartford. Julia LeBlanc, Fox 61 News.